Shari Taylor, who I've known for 6 or 7 years. I think we met in New Orleans, and she is going to do, tell us a little bit about her training and her background. But the relevant piece here is that when Shari was first becoming involved or interested in psychedelic therapy, she had invited me to the original dinner that they had in New Orleans. And the dinner, I ended up not going, and Shari went and had a remarkable connection with people in New Orleans that wanted to establish a team of people that were going to research the use of MDMA and psilocybin. And that kind of changed her life. So from there on, she has been doing this work for 3 years, has it been? Yeah, so 3 years in New Orleans. She's been visiting me at Terramuse here. We've had a wonderful visit. And I'm gonna turn it over to Shari, and she can kind of fill you in on the details of what she wants to talk about today. So Thank you, Shari. Okay.
So I'll just give you guys a little background on myself, and then I'll be talking about the research that I'm involved in with MDMA, and answer any questions that you might have. So I've been working in the field of mental health for over 15 years, and I started off as a nurse and then a nurse practitioner, and I worked mostly prescribing medications to people. Then I went back and got my PhD in psychology and incorporated more psychotherapy into that, and worked in that way for many years. And just kind of was always looking for, new ways to help my patients. As I think David said that some of you guys are therapists, but working with patients who have PTSD can be a slow and painful process. And I was always just sort of looking for other ways to help people. And, in all of my training, the historical use of psychedelics was never mentioned. And I didn't have any personal experience. And so I just didn't know that. And the way that I got into it was I just happened to come across a documentary on Netflix called DMT, the spirit molecule. I don't know if any of you guys have seen that, but DMT is the active ingredient in ayahuasca. And the documentary is about a doctor that did some research with that. And I was just fascinated and intrigued. And I did more research on that myself online. And I found an organization called MAPS, the Multidisciplinary Association for Psychedelic Studies. And they've been around for since, I think it was founded by Rick Doblin in 1986. And they've been studying the use of psychedelics. And I got on their newsletter, and probably a year or two went by, and then I just got an email about this dinner that they were hosting in New Orleans, and that's how I sort of got involved in it. So I thought I'd just sort of talk a little bit about what MDMA is and how we're using it in research to help people that have PTSD. So MDMA it's 3,4-methylene dioxymethamphetamine. It was developed by a pharmaceutical company, by Merck, in 1912. And so it's been around for a long time. It was used in the 50s, 60s, and 70s by therapists and psychiatrists. Just a sort of a side note, MDMA it's not ecstasy. Ecstasy is the sort of the street name, and ecstasy sold on the street typically contains other things and often doesn't have any MDMA actually in it, but that's sometimes what it's known by, just so you'll have a reference for that. And then another one of the medicines that I've been trained to use is psilocybin, and that's magic mushrooms. So just a little background, psychedelics really flourished in the 50s and 60s and showed great promise in the fields of psychiatry and neuroscience and the study of mystical experiences. But they began to be used by the counterculture and the anti-Vietnam War movement, and were used recreationally. And so the government made the use of them illegal in 1985, and then just began shutting down all the research that was going on with these substances. And so Rick Doblin, he founded MAPS, and it's a nonprofit organization that funds research in psychedelics. And just to give you guys a little background, I'm sure you all know what PTSD is, but it's a diagnosed mental condition that can be chronically debilitating. We don't know why some people develop PTSD after trauma and others don't, but we do know that it doesn't go away without treatment. And there just aren't a lot of great treatments for it. Symptoms of it can include avoidance, trying to keep the experience from happening again, no matter how unrealistic that might be, experiencing fight or flight responses in the body, re-experiencing the trauma in the way of flashbacks and nightmares. There's an increased suicide rate, higher incidence of depression, anxiety, substance abuse, unemployment, and just an overall decreased quality of life. Current treatments include psychotherapy. It usually takes a very long time. EMDR is also a treatment that's used, but patients often drop out before the treatment is completed. Two medications are approved, which is Paxil and Zoloft. These have to be taken every day. And these are medications that I prescribed for years. And they can be really helpful, especially in acute situations, but I sort of feel like it's sort of like putting a Band-Aid on the wound, and it does sort of help, but you're not really getting at the root of the problem. And so that's why I've just been really interested in this research. And even though MDMA has been around for a long time, we had to go through the process. Just to, maybe if you guys could mute yourself unless you have a question, it sort of helps cut down on some background noise.
If we had Stuart up, I wonder if we can see you. Are they able to see
Yeah.
you? Okay.
Mm-hmm.
Okay, good.
Yeah. I think someone joined, Khalid.
Oh yeah.
And maybe if you could just push your mute button, that
Okay.
might be helpful, Khalid. So basically, even though MDMA has been around for a long time, we're having to take it through the process with the FDA like it's a new drug. And it's a really long process. It's, there's different phases of research. You do phase 1 where you're sort of looking at the safety, and then phase 2, the efficacy, and phase 3, comparing it to current treatments. And so we've gone through that process with MDMA through the FDA. And there's 16 sites around the world that are studying MDMA-assisted psychotherapy for PTSD. And just to give you a little overview of what the protocol looks like, we give it to patients 3 times over about a 4-month period. There's a screening process where we do an EKG, blood work, just make sure that they are physically pretty healthy. They need to wean off of any medications like SSRIs that they're on. And then we, after the screening is done, we do some preparatory sessions, and then we give the medicine 3 times a month apart from each other, and there's integration sessions in between. And the MDMA sessions, it's an 8-hour therapy session with 2 therapists, a male and a female therapist. And we kind of do it in a setting where it's almost like a living room, where there's low lighting. It's very comfortable. We encourage the person to lie down, and it's a double-blind study, so half of the participants receive placebo and half receive MDMA. And just to kind of tell you a little bit about how it works, it's theorized, like antidepressants, it affects serotonin, a neurotransmitter in the brain. It also affects dopamine, which seems to give people the motivation to work on things in an 8-hour therapy session, which is, it's an all-day thing. It also works on hormones that increase trust and alliance felt for the therapist. It works on oxytocin and prolactin, and this can sort of promote feelings of well-being and trust, which is really important when people are working on these things. It also decreases what's happening in the amygdala. And so it's theorized that the amygdala sort of lets down its guard under the drug's quieting influence, and the traumatic memories can reemerge from the hippocampus to be sent up for the higher processing the brain didn't do in the immediacy of the trauma. And the reprocessing is assisted by this tide of hormones, which really is, they engender powerful feelings of intense emotion. And we encourage people to put headphones on and eye shades and really go into their inner experience. We call it the inner healer. And it's sort of felt that, the body, the psyche can move towards healing if just given the circumstances, the opportunity, just like if, we get a cut on our leg or something, if given the right, if we keep it clean, the body has a way of moving towards healing, and the psyche can do the same. But I think that often, when we are just doing 1-hour therapy sessions with clients once a week or twice a week, it's just not quite, enough time. And so that's why I really like this long 8-hour therapy session that we can do on this medicine. As far as the training goes to do this work, I thought you guys might be kind of interested in that. It's a 5-part training program that MAPS has developed for therapists, and it involves 5 parts. There's a 15-hour online course, and then a week-long retreat type in-person training with therapists where we watched hours of videos of sessions with patients. And then there's a home study assignment that includes outside workshops, and then a 5-day in-person training where we learn about holotropic breath work and other sort of somatic therapies. We do use touch in some ways in this type of therapy, and there are a lot of agreements made beforehand, but it can be very helpful for people to hold our hand, or we're very sort of intentional about talking about that beforehand, what we'll do, and as far as that goes. And then there's also, as far as the training, an open label trial where we had a participant that we knew was getting MDMA. There wasn't a placebo involved. And the sessions, we went through the whole protocol. The sessions were recorded, and then we have a supervisor that evaluates us. And then MAPS also developed another research study specifically for therapists to be able to take MDMA themselves and go through the experience with a therapy pair. And so I was able to do that, which was really helpful, just to be able to see what it would be like for the participants, and I was able to do that. And then they also had us go through a placebo session as well, just to see what that would be like. So we're in phase 3 of the clinical trials right now, and the FDA has designated this, given it a breakthrough therapy designation. So if the results from phase 3 are anything like phase 2, it will be able to be fast-tracked for approval. And the results in phase 2 were just really, remarkable, I think. In these early trials, at the end of the protocol, the people that received placebo with psychotherapy, 23% of those no longer met the criteria for PTSD. And when you add MDMA into that, the results went up to 61%. And they do a 1-year follow-up with people, and surprisingly, then it went to 68% of people no longer met the criteria. So people actually continue to get better over time. Things sort of are continued to be processed, and there wasn't any indication that there, any kind of addiction or abuse or dependence happened either. And I want to just leave a lot of time for questions, because I don't know which parts, if you guys are more interested in, but I wanted to talk a little bit about psilocybin. I went through the training with an organization called Compass out of the United Kingdom. They're doing some research with psilocybin, and we were going to be one of the sites in the United States for them. Just logistically, that ended up not working out, but I was fortunate enough to be able to go through the training for it. And there's actually a lot of research using psilocybin. It's being used to study treatment-resistant depression, end-of-life anxiety. You can just Google it, and there's a lot of things you can read about it. But the study that we were going to do with Compass was for treatment-resistant depression, which is people that have tried at least 2 antidepressants and that without effect. And with that study, they actually were only giving it 1 time. And so they had a screening process and prep sessions, then the medicine day, which was also an all-day session, and then some integration sessions afterwards. So it was a little bit shorter protocol. And Robin Carhart Harris, he's a researcher at Imperial College that has done a lot of work with psilocybin using fMRI and looking at doing brain scans to just see sort of what's happening in the brain with psilocybin. And those results you can look up online as well, and they're quite remarkable. I guess I could stop there and just see if there are any questions so far.
I have a question.
Okay.
I have a question. In both cases with MDMA and psilocybin, is there a protocol, has there been a protocol sort of advised as to how the dosage would be worked out for different folk? Obviously, body size and previous usage would come into that. I'm just curious.
Oh, good question.
Protocol.
Yeah, they in the initial phase of the MDMA trial, they were using 75 milligrams of MDMA, and they actually found that right now what we do is we give 80 milligrams there's 3 sessions. So for the first one, we give 80 milligrams, and then 90 minutes later, we give a booster dose of half of that. So another 40 milligrams. And then for the second and third sessions, we discuss it with the patient. We see, how they felt on that dose, and we have the option of going up to 120 milligrams, and then the booster would be 60 milligrams. In the earlier studies, they had given 75 milligrams, and they found that with that lower dose, that it actually, they noticed a little more anxiety with people, sometimes because of the amphetamine component of the drug. As it's coming on, people can experience an increased heart rate, and the blood pressure goes up a little, so it can, sometimes that can mimic an anxiety attack and get people anxious. So they found that with the higher dose that it actually was more helpful with reducing that. So the dose that we do now is 80 and then 120. And then with the psilocybin, they're looking at that right now. The study that we were going to be involved with was a comparison of 1 milligram, let's see, 1 milligram, I think it was 5 milligrams and 10 milligrams. It was basically a very low dose and then a moderate dose and then a higher dose. And they're just trying to sort of figure out what is the optimum dose. I think at Johns Hopkins and some of those places that have been doing research for a while, 3 grams is kind of a typical dose. It's made in a lab, it's synthesized in a lab. It's not, they don't give the actual natural mushrooms so that just so that they can be really accurate with the dosage.
Yeah, thanks for that. I suppose the dosages, in the case of MDMA, it's like, yeah, 75 milligrams. It's sort of that's an easy enough level to enter in at. For somebody like myself, say, coming in, I'm hitting on 19 and a half stone. I don't know what that is in kilos, but I'm just wondering, is the options, is there an absolute cutoff to say, okay, that 120, that's the ceiling? Or it's hypothetical, I'm just curious, really.
Yeah, they haven't really looked at that at any doses higher than that, as far as I know. So yeah, I'm not sure if there's going to be sort of a maximum recommended dose, but right now it's we're doing 120 and 60. And giving the booster dose sort of just extends the duration of the experience, so that it, can really last most of the day. And that's the main reason that we do that.
Yeah, 8 hours.
The option.
8 hours, you'd be well sort of back, back in the room, as it were, with that job.
And we have our participants now, they spend the night at our facility, and then they have, a family member, someone pick them up the next morning. And we actually, we have a night sitter that comes and stays with them and brings them dinner and eats with them. And then we have, art supplies and things that if they want, they can do that. And then the next morning, the therapy pair returns and we have our first integration session. And the integration sessions are, we just kind of help the person make sense of what happened. They can tell us about their experience. It's definitely a non-directive approach, though. And a lot of our training is actually to sort of untrain us as therapists, because we're not doing psychotherapy. We're really, the therapist's role is just as a facilitator who assists the client in uncovering their own truth, their own process, providing a safe space, doing a lot of mirroring. And the sessions are all videoed, so that, and we have adherence raters that will watch them and just make sure that we're following the protocol. I think it's really just a great idea that they have a male and a female therapist, because it can, sometimes there's transference that happens. Say somebody had a really difficult experience with their mother, and they could project that onto me and maybe form an alliance with my male partner. And we really work with that. And, sort of, I think it's helpful for people to have that, both the feminine and masculine sort of energy there. And then I think it also helps people feel safe, when there's two people there. And we have, one of us is always in the room if somebody needs to use the bathroom or take a break, and we never leave the person alone. And so I really like having the dual therapy team. Any other questions that any of you guys might have?
I have a question about, my name is Jeb. I live in Boulder. I believe we have a map site here.
Yeah.
Anyway, my question has to do with screening the clients and where the clients are coming from, where you get your referrals. Also, and you've already touched on it some, but my training is more in traditional treatments of PTSD, cognitive, and EMDR, and brain spotting. So the types of therapies that you use, which you've already touched on, but
Yeah, thanks for that question. We get recruiting it's been interesting. We've had a lot of people reach out, and mostly they find us through MAPS. And there's been a lot of coverage in the media of this research, and people will either see it on a news program or read about it somewhere, and then when they go on MAPS website, and their website is maps.org. There's a lot of information and resources there if any of you guys want to check that out. But once you go to the website, there's a place that says, would you like to participate in research? And they have a sort of an online form that people can fill out that asks them some questions, and then it directs, depending on what zip code they put in, it directs them to the site that's closest to them, and then we we screen them from there. And so we screen quite a few people, but there are criteria that, health issues, things that might exclude people. And so, if people do sort of pass the initial criteria screening, then we bring them in for in-person screening. And also, just you guys might be interested as clinicians, we use the CAPS, the Clinician Administered PTSD Scale. This is how we measure the level of sort of severity of PTSD, and that's done before, during, and after treatment, and then again at 1 year out. And so that's how we're evaluating that. I'd be curious to just hear, about what some of your interests, and what brings you guys to even be on here and be curious about it. And if anyone wants to share, that would be great.
If I may.
Yeah, I'll jump in first if you want. I've worked as a therapist for the last 20 odd years, I suppose more, through Jungian approach and Gestalt. But I've always had a strong interest in the transpersonal, so holotropic breath work. I've done all of that for many, many years, and I've also facilitated in that work. With the MDMA work, I've used it a few times with clients in very specific, isolated cases. So most of my experience would be my own experience. And I found that methadone was an easier substance to work with than MDMA. I would have always used pure MDMA. It was never sourced off the street. So I'm curious if you have any experience with that, which is a derivative of, it's one of the MDA classes of drugs. So it's very, very similar to MDMA, but it's a little bit softer, it's smoother, it's a little bit easier on the system. Now, the doses that I suppose we're talking about here, where you're not pushing people right up to their limits, it possibly wouldn't make that much difference. But if somebody wanted to sort of go deeper or have more of a boost, then it's an easier substance to work with, I found myself. I was curious, you mentioned in the MAPS training that there was a component of breath work within that. Do you bring that in and use that ever with clients?
Well, we don't actually do breath work in any of the sessions. I think it's more, the training was more to get experience just with non-ordinary states. And so that we as therapists would have more experience ourselves with being in a non-ordinary state, what that might look like, so that we could, kind of relate to our participants, in a better way. And I love holotropic breath work. I think it's just something that, is available to a lot of people, and it's, a lot, obviously we all can do it at any time. So it's a lot more available than, trying to be in a study. So I'm a big fan of it too.
The reason why I'm here today is I'm a naturopath, and I've worked with war refugees from Syria and Palestine since 2015. And I'm looking into methods and ways to ease the complex traumas they have experienced, because unfortunately, the wartime trauma they have gone through, the escape from their countries, doesn't of course end when they arrive at a supposedly safe space. They are also, they face financial hardship, societal hardships, and so on. And I've been looking into the various methods that I could apply for that group of people, especially since I have very close friends who suffer from complex traumas. And they fear that they're going to give this further to their children. So, yeah, that's why I'm here.
Where do you live, Khalid?
Have you had experience with that population segment, with war?
Not with refugees. We've had, veterans and people that have experienced, war-related trauma, but no, I don't have any personal experience with refugees. Where do you work with these people?
I'm currently living in Hamburg in Germany, but will probably move away in the future to be closer to home. I'm Palestinian. So working from afar, of course, is not very beneficial for either party.
Thank you for being here.
Sorry if I can just jump in again. Khalid, I remember seeing work done by a group of children who were refugees. Now, this is going back about 10 years ago, so it's quite some time ago. And it was done through art. So the work itself, the artwork, was brought around and was presented as part of a seminar that I attended. And it was absolutely tremendous. The depth of feeling that was coming through in the art was absolutely tremendous. And, that type of work is available for everybody.
Thank you. I'm afraid I do not work with children because I don't have the qualifications for that, and I don't want to create more havoc than there already is. So I leave that to the specialized folk. My focus is currently more adults and adult trauma. And especially, I'm not sure if this is the right word for it, transferring the trauma. I'm sorry, I keep forgetting the names of the famous people who did research on the vagus nerve and how intergenerational trauma is inherited. Because that's unfortunately a very big topic in our culture, where we inherit traumas from our parents and our grandparents as well. So that is more my focus.
Would anyone else like to introduce themselves and just maybe tell the group where your interests lie.
So I'm not a therapist or anything, but someone who has acute panic and anxiety issues that I'm kind of been working through. And so this as an avenue is pretty interesting to me because it's sticky. And yeah, I like about that.
Thank you for your interest in being here.
Okay, I'm Patty Ankrum. Can you see me?
Hi,
And
Pat.
I see that's my neighbor, David. I'm across the street.
Oh, I met you yesterday. Yes.
Yes, yes, nice to meet you. So anyway, I was initially interested because I had a bone marrow transplant in 1994 for stage 4 cancer. Well, it worked, but I've had like problems with chemo brain and with my memory, and I also have anxiety, and so I was very curious if an experience like this would help me to kind of do what it does as far as like memory, my recall, ability to focus.
I don't know if it would help with the memory and recall, but they are definitely doing a lot of research looking at psilocybin for anxiety related to, diagnoses like cancer. Johns Hopkins has done a lot of work on that, and so if you Google that, they have actual patients that have gone through the treatment that talk about how it's helped them and sort of what they've gained from it, and that might be of interest to you.
Okay, thank you, and thank you for coming today.
Sure.
Again, if I can jump in, I've loads of questions, so I hope you don't mind this in and out. Anyway, in just a follow on to what you were saying, Patty, the area of microdosing as an alternative ongoing type of treatment. So microdosing with psilocybin is something that there's quite a lot of research being done on as well. Do you have any knowledge of that, or is there anything that you can add to that, Shari?
Yeah, James Fadiman has done a lot of writing about that, and so he's, would be a good person to just Google, and he talks a lot about that, and I know that it's, I sort of just have kind of anecdotal information. People that I've talked to that have used microdosing with psilocybin to get off of their antidepressants and have found that helpful. And there's, a lot of information that James Fadiman has put out on, kind of what that regimen might look like and that kind of thing.
Oh, great. Thank you.
Would there be any opportunity to have sessions at Terramuse, or is that like getting it registered and everything like that, the hurdles are too much?
Well, we're hoping that someday, once it becomes, a legal form of therapy, it would be great. I'm visiting Terramuse for the first time right now, and it's just such an incredible place, and would just be so perfect for that kind of thing. So hopefully someday that will be available.
Yeah, it's pretty wonderful out there.
What might the time frame be before this does become approved?
Well, the time frame for MDMA assisted psychotherapy for PTSD, is specific, to that, and we're looking at probably 2021. But it will, need to be done by, there'll probably be, a lot of regulations associated with it, where it'll need to be done by a trained therapist, and I don't know exactly what that will look like. Psilocybin is sort of on the same kind of track to be, moved from a Schedule 1. These are all Schedule 1 substances now. And so, unfortunately, with being Schedule 1, they're not able to be used for medical purposes. But if that changes and they get moved from Schedule 1, then they will be. So, we're just sort of waiting for, the research to prove the benefits. And so, so far it's looking good, and hopefully that will continue. Would anyone else like to introduce themselves and maybe say a little something about what your interest is?
Hello, let me try to do it. My name is Salina, and I have no relation to psychology and some therapy practice. I'm an artist myself, and I only experience that psilocybin and other stuff on me. And me and my friends we were wondering about to share that experience with other people. But in Ukraine, where I'm from, the thing is illegal. And it's funny that the only way to do it is to make the church, where the part of some kind of ritual will be taking anything you want. And I was wondering, maybe you know some cases in Western Europe that are successful in this thing or not. This is my first point of interest. And the other, I just found that those kind of therapy is powerful for me and it works. And I just wanted to know more, so I'm here listening. That's all.
Oh, great. I'm so glad that you're here, Elena. I don't know in Europe about that as far as developing a church. In the United States, I do know of some people that have started a church in order to offer ayahuasca to people. And so it's probably a similar thing to that. I haven't heard of that done with psilocybin, so but I'm sure it probably is somewhere.
If I may interlude, I'm sorry to interrupt. For Alina, this might interest you or anyone who lives in Europe. There are groups, there's one very controversial group that is more a company actually, that offers ayahuasca retreats all around Europe. It's called Ayahuasca International, but they were shunned by the shamans in South America, in Colombia and Peru. I've heard mixed reviews from that group, but they seem to be more on the safe side in terms of their medical administration of ayahuasca. Plus, there are underground groups that you'll need to look for on forums, etc. Up until now, there hasn't been any kind of accidents, anything serious, with one exception maybe in Germany, but that was a different matter altogether, that I've heard of. So there are groups, they're not religious groups, they're more loosely based, more, non-religious affiliated.
Thank you for the information. I will Google it. You said Ayahuasca International, right?
Yes, I have. I'll send you the name on private chat now.
Thank you.
Anyone else like to introduce themselves?
Yep, I would like to. Hi, everyone. My name is Alexandra Kralikovska, and I'm from Ukraine, as just Alina. Welcome from Kiev. Greetings from Kiev. I'm an artist and curator, and also my interest focus on culture and philosophy and contemporary art. And also I'm a psychologist by my education. And recently I decided to take a path of art therapy and get a master's degree in it. And since my personal experience with psychedelics was quite bright, and still I'm convinced that it's one of the best tools to work out my psychological issues. I'm curious, do you face any time like combination of art therapy and psychedelic therapy? Is it possible? Do you have any experience?
I don't know of it, being sort of a specific combination right now, but we do encourage people after their trip to draw, and we have art supplies, and it's really been interesting to see what people draw, and then we talk about it in their integration sessions, and they describe it to us and explain it, and I think that it's a very useful tool. David's the expert in that.
Well, let me just interject here. I am a trained art therapist, and I see a very strong application with art therapy to this work, because so much of it is visual and non-language based. So the idea of transferring what your experience has been to a visual mode and kind of not using words, I think gets a lot more of a direct expression of it than actually recounting it with words. So keep with that with the art therapy. I think we're going to see a melding of the art therapy with the psychedelic work. Yeah.
I agree. It's when people have a mystical experience, it's ineffable. That's one of the qualities of it. It's very hard to put it into words and to describe it and explain it, and sometimes even trying to do that changes it in some way. So I think that expressing it through art is so valuable.
Right, and also movement. Doing movement work. We've been talking about various forms of dance work or movement work where a person can translate it directly into their bodies. So these are all going to be opened up, because people. The experience itself is creative, so it needs a kind of a creative response or expression of it. So
Awesome, thank you. I didn't know, David, you are an art therapist.
yeah,
Really awesome. I will have to talk to you soon.
yeah, good. Let's keep
in touch.
Anyone else have any thoughts on that or anything else?
Yeah, I have another comment maybe that I can add to it. I've had a lot of experience in using full range of different substances over many years, I suppose. But I was curious and about the methodology, about how the protocols for the session, using the blindfold and lying down and stuff like that. And I've done both, experienced both. I think that's great up to a certain point, but also I think it's a totally different experience without the blindfold. And I know it's then opening it up to a lot of other sort of transference and stuff like that in the room. But it's just a different experience. It offers another window where person's dynamics become more relational in the room, and in some ways more visible. To have the blindfold on, both in this work and also in other types of like with LSD and stuff like that, it becomes a very, very internal experience where where I feel, yes, there's great benefit in that in itself, but also there's great benefit in being able to work it out in the room to some extent and to bring it out. My own experience with artwork has been tremendous. I think it's a brilliant way of processing the experience both in a session and outside of a session. But I just wanted to add to the bit about the blindfold. Yeah, it's a totally different experience without the blindfold. And also the use of music, of course, can bring so much in. It's very directive when we use music, like what types of music you use. Similar in a holotropic breathwork session, the music carries it, and it's not just, oh, let's play this or let's play that. It's very specifically chosen for certain types of process. So the assistance in the altered state of using music, I think it can really, really add to the power and the depth and the scope of the session. Once you know what's sort of going on for the client, you know, you can sort of have sort of music in the background for certain different aspects of the client's process if they go there.
Yeah, I think music is a very important piece of it. Just to give you guys maybe an example of a patient that I worked with a veteran who, when he came, you know, to us, he'd been to Afghanistan and he had worked with people that were injured there, and you know, really had a lot of trauma from that. He had this just this hatred and a strong visceral feeling when he would even think about Iraqis, and he would talk about this in his prep sessions. And during the MDMA session, he spent a lot of time just inside his process with the headphones on and the eye shades, and you know, occasionally we'd sort of see a tear come out, and you know, we'd be watching his breathing very closely, and we could tell he was having, you know, some real inner experiences. And when he, you know, came out of it, he had this completely different perspective, and he said, you know, the Iraqi people, they didn't want us there, and you know, we were coming into their country and you know, kind of taking over, and of course they, you know, acted in this way. They didn't want us there, and he just looked at it in such a way that it provided a lot of healing for him. And you know, that whole process was just done on his own. And I think that sometimes you know, with MDMA, because of the amphetamine component, sometimes people want to do a lot of talking, and you know, that can be helpful, but it can also be a distraction. People tend to kind of get caught up in their story. And we will periodically encourage them to, we just call it going inside, you know, and we'll say, you know, would you be interested in going inside for a little while? And it seems, just from what I've seen, that is actually where the magic happens. And that's where people's inner healer brings to them what they need. Healing looks different for everyone. You know, we don't particularly know what is going to help someone heal, but there is something inside of each one of us that does know, like an intelligence or intuition or whatever you want to call it, and really allowing the space for people to get in touch with that, I think is super important. And then you know, processing what they experience, maybe, you know, afterwards or towards the end, or you know, in the integration sessions, can be really helpful to sort of cement it and make it a part of their everyday life. Oh, hi, David. I just saw you.
Hi, Shari. Hi.
Are there any thoughts on how long a client would be working before this type of therapy would be advised or suggested or offered?
Well,
And
the
also
way
after those sessions are completed over the 3 or 4 month period, is there any advice given or offered about how long a person should remain in that sort of integration phase of the work, which I would see as being perhaps more important,
yeah, integration
where
is
the real work gets done?
integration goes on for a long time, but as far as the study, we are looking at, we do 3 integration sessions after each medicine session, and then we have to sort of end it somewhere. So that's the end of our contact with them, except for the 1-year follow-up. But we do give people sort of an exit plan and a lot of resources to, a lot of the people actually already are in therapy with the therapist, and they'll kind of continue on with that. But it's, sort of, we've just speculated and thought that maybe down the line when this is a legal therapy, that it might be helpful for people to come back, once a year or once a couple of years and have another medicine session. That might not be necessary though for some people. I think that some people really feel kind of, complete. I mean, 68% of people in phase 2 no longer met the criteria for PTSD. So that means that they no longer had symptoms. That doesn't mean that they won't want to continue to, just work on things and be involved in sort of self-development. But it seems to be a sort of a treatment that is doesn't necessitate ongoing sessions. I think that's one of the things that really gets me excited about it too, because I've just worked with a lot of people that have been on antidepressants for years and had to take them every day and experience side effects, and the side effects continue for as long as you're on the antidepressants. And so, having the option of, giving a medication 3 times and that's it is just really appealing.
I think just in relation to what you said there, the focus obviously to get it approved through all the different levels of government and all that is it has to be focused on people who are stuck in different situations like PTSD or depression or that sort of thing. But this type of work also not just in terms of problem solving, if you like, it also offers a totally different journey for anybody who's involved or interested in taking that journey, which is very ongoing. It's like it's a lifelong journey, really. So it opens the door to more of a spiritual journey, if you like. And that's like another side of it, which is not really spoken about or recognized so much in the official things.
Yeah. Does anyone else have any other comments or questions?
Is there some method which you use to choose a right kind of trip sitter or whatever you call it for your patients? And maybe you test do you test some character individual things, or you just put a random people, or how it works? Because I know a lot of people that that might found the psychedelic therapy helpful, but they have like they might get paranoid, and how to make a right pair of person so your patient will feel okay and safe. And I hope it was clear.
Are you asking how to pair the patient with someone that will be sort of a good match for them? Yeah. You know, I mean, part of the process of preparation is to sort of form an alliance and trust, and really, I think a key to this is for the person to feel prepared and feel like they're in a safe setting with people that, you know, have experience working with these medicines and are really, you know, taking care of them. It's really necessary for people to be able to surrender and, you know, obviously if someone has people putting a blindfold and headphones on can be very scary if you don't feel like you're safe. So we spend a lot of time, you know, really just kind of promoting that relationship and making a lot of agreements and really preparing people for what they might expect and what can happen. If you go to maps.org, they actually have a sort of a trip sitting journal or manual actually that you can download, and so it might be of interest to you, Alina, to just go take a look at that, and it kind of goes through what might be helpful if you're, you know, trip sitting.
Barry, can you say something about the counterindications? Contraindication.
Sure.
This type of work.
So some of the contraindications would be, you know, there can be drug interactions. So that's really important to make sure it's clear what medications, even supplements that the person is on. With MDMA, it can increase heart rate and blood pressure, and so that's why we sort of do cardiac, you know, workup and make sure that that people, you know, would be able to tolerate essentially what would be similar to vigorous exercise. And you know, with that's mainly, you know, any kind of liver issues. We do a lot of blood work, looking at liver enzymes, sort of a full, you know, workup just to see if there's anything going on that we need to look into further. Yeah, I mean, I don't know how in, you know, in depth you want me to go, but mainly I think the one of the most important things is making sure it's clear what supplements and medications the person takes. Does anybody else have anything? I can, you know, put my email too if any of you just think of any questions or anything afterwards. I'm happy to you know, talk to you individually too.
And I wanted to just mention that we are recording this, so I will post it. There are a number of people that have expressed interest in our meeting here, but we're not able to attend. So we will post it again. So if you know folks that might be interested in this, it'll be both on my personal Facebook, but also on the group that I formed that were interested in this meeting. So.
Well, thank you, everybody.
Thank you.
For your time.
Okay, good.
Thank you.
All right. Stay healthy.
Yeah.